Welcome. And this evening, I'm going to show you my presentation on breast health awareness. And tonight we're going to have a focus on medical thermography screenings with my presentation. And later on, Gail Marie is going to discuss ways to enhance your breast health. So it could be for women, men, everybody has breasts. So this is a presentation for both men and women. Gail and I both want to say a huge thank you to Marlene's Market in Delhi for hosting this online event for their clients. Gail's actually here with me, so she's excited in the background here. So for those of you who are not familiar with medical thermography, it's most well known for breast thermography, but it's actually used on men, women, and kids for full body thermography. So today, I'm going to tell you about my company a little bit, Flowell, and how our primary focus is performing medical thermography screenings for our patients. There's a lot to cover, so please type in the chat box if you have any questions at all. I'm going to do my best to answer all questions live on the presentation, but if not, I have your email addresses and I will certainly get back to you afterwards. Okay, so this is a little bit about me. I'm a CTT, a Certified Thermographic Technician, and I'm also an IBDS, which means I'm an independent Beamer distributor at the senior level with the company called Beamer. I'm the founder of Flowell, and I was trained through PACT, the Professional Academy of Clinical Thermology, and I'm also a member of BTI, Breast Thermography International. I primarily service Washington State. I'm actually from Massachusetts, and I've lived in many places here in New Hampshire, the Virgin Islands, South Carolina, Florida, and now Washington State. So I'm really excited to be here tonight and to tell you all about our presentation here for Breast Health Awareness Month. These are the states that we service from my company. There are a couple technicians who work with Flowell, Janelle Solomon and Kristen Schwartz. Janelle's in South Carolina, Kristen's in Florida. And so please keep all these states in mind as we go. We do have a very generous referral program if you decide to monitor your health with the medical thermography. So basically you get a $50 credit for anyone you refer, and it goes towards your own scan. And we're talking about thermography tonight because it's ideal for preventing future issues, but it could save someone's life with possible cancer detection. So I have a question for you ladies. Some men may wear bras too, I don't know, but ladies, how many hours a day do you wear your bra? So please type in the chat box how many hours a day, and we're going to come back to that question a little bit later in my presentation. There we go. So what makes thermography so popular? As members of Breast Thermography International, most of our patients end up finding us because they want a breast screening and they're fed up with screenings that radiate their body or compress their breast tissue. And if you expose yourself to too much radiation, it can literally cause the disease that you're screening yourself for. So with thermography, not only can we check the breasts, but we can evaluate the health of your entire body. And this is so important for breast health awareness due to the following stats here. So 1 in 8 women will develop breast cancer. There's 280,000 new cases every single year of invasive cancer. And over 40,000 deaths occur annually in breast cancer for both men and women. 80% of breast cancer patients don't have any family history. And it's expected to grow from 280,000 to 440,000 by 2030 of the estimated new cases. And then for men, it's 1 in 833 men are diagnosed with breast cancer. So what exactly is cancer? Cancer is when cells in your body are, it's the uncontrolled proliferation of cells in your body. Normally our immune system keeps precancerous cells in check, and it doubles on average every 90 days. So here's another slide, kind of showing a tumor growth here. Cancer goes through a process called angioneogenesis, where precancerous cells can latch onto a blood supply, feed off of our nutrients from our blood, and that's when they double on average every 90 days or get hotter. So when your immune system can't keep these cancer cells away, that's when the doubling on average every 90 days occurs. And this is one of the most important factors that our interpreting doctors consider when they make recommendations in each thermography report. We have normal to abnormal thresholds throughout our entire body, and the details of what's going on in your body are discussed when you learn about your report from us. So if someone has abnormal temperature thresholds or they're approaching their thresholds, our interpreting doctors will base your recommendations on these findings. It's very important to follow up as recommended to make sure the temperature findings are not increasing because of this chart right here, where you're detecting breast cancer. So if there is an unusual hot spot, if it were something that was turning into cancer in thermography, and in some cases you can see it at like 256 cells, versus anatomical testing such as a mammogram, it may be over 268 million cells, or 7 years later, that it is then detected on anatomical testing. So the different screening methods out there are mammograms, ultrasound, MRI, and thermography for breast cancer detection. Ultrasounds are safe for the body, and MRIs without contrast are actually therapeutic for you. It's magnetic imaging. So with mammography, it emits ionizing radiation that can be painful. 80% of the biopsies come back negative, 20% are false negatives, and mammogram guidelines are currently being challenged at this time. They're saying it's too much radiation for women in their 40s, and should they go ahead and move that up to age 50. They actually did recommend that up in Canada. So with thermography, these are the things that we look for: thyroid screening, breast cancer detection, cerebrovascular screening, hormonal imbalances, spine analysis, deep vein thrombosis, nerve pathology. So our infrared cameras and our software allows the expert thermologist to analyze your temperatures and vascular patterns throughout the surface of your entire body. And I know Gail's going to touch more on the anatomy of the breast a little bit later. But after you establish a baseline with your thermography scan, your report will discuss any areas in your body that could indicate imbalance, which could be toxicity or hormonal imbalance. That's most common. And then if those things are out of balance for a long time, they could lead to cancer and other diseases, injury, and more. So keep your breast health in check, and the rest of your body as well with thermography. So thermography detects the physiology of your body instead of the anatomy. It can detect cells that are not yet dense enough to show on an X-ray or a mammogram. There's no compression and no radiation, and it's safe at any age. That's why we scan men, women, and children. Our youngest patient is 2, and our oldest patient is 96. Here are some case studies coming up. It says these slides will be we're going to use these slides for educational purposes. We do show you some normal slides to extremely abnormal slides. If you're squeamish, you may want to, look away. There's going to be a warning slide because we do show a few cases of breast cancer. So for this woman, she has fairly normal images of the breasts. All her temperature thresholds are within normal limits, and due to her vascular patterns, the future monitoring for her is recommended at 6 months to further establish a baseline. These ones are abnormal images of the breasts. And let's see here. So this slide and the next are images of the same patient. So here we see the rainbow palette to best see heat and color. And the following slide, we're going to see inverse grayscale palette. It's a black and white image where you can best see vascular patterns throughout the entire body. This woman has an abnormal threshold from normal to abnormal findings. Considering her history, this patient does not have a cancer diagnosis. Our interpreting doctors recommend a 6-month follow-up thermographically and to compare to ultrasound imaging. So you can see this hot spot here that's above the left breast is not over here. So therefore, that's one factor that our interpreting doctors consider in making their recommendations of come back at 6 months and go compare to ultrasound imaging. So for breast health awareness tips, let's see, underneath the breasts are really red hot. That's normal. Before she lifted her arms, the breasts were touching her upper abdomen. So that's going to be normally hot under there. But one thing I see that she definitely could improve here is the heat signatures in her armpits. So you can even see some white hot color here. So that tells me, can she change up her deodorant? Is she wearing an antiperspirant that's literally trapping toxins in her armpits, which are right next to the breast tissue? Is she someone who works out? Could she sweat more to push out those toxins quickly? And then this heat signature here in the left breast, it's further up on the breast. So is it coming from the mouth? Is there something going on in the mouth that could be leaking down and kind of congesting this area? So there's many things that we can sort of check for with thermography here. This could be lymphatic congestion, and lifestyle changes could definitely help her to see an improved thermography report and boost her immune system at the same time for her follow-up. So other tips that we go over with patients could be self-breast massage. They could try a medical device that I personally use daily called a beamer that increases the blood flow in your body. And of course, you always want to go over these reports with your physician. So right now I'm going to go ahead and type a link into the chat box for you. I just have to move some things around a little bit to get there. But basically, it's a description of how to do self-breast massage. Something every woman should know about for sure. Here we go, I found it. So it's on YouTube. It's a really quick video, 5 minutes, but just go ahead into the chat box and grab that video to watch it later. That way you can get educated if you don't know how to do self-breast massage yet. This could help to improve your immune system, to reduce any stagnant toxins lingering in the breast tissue, and improve your next thermography scan. And you can see we have a customer service expert, Isabel, who works with Flowell. This is her email address. If you're watching the recording, just email Isabel and she'll send you that link. So this is the same patient. You can see this darker vascular pattern. We use rainbow palette so you can best see heat and color, inverse grayscale so you can best see vascularity. And our interpreting doctors for these images wanted to check on this vascular pattern compared to this side of her right breast to see what is the difference in temperature. And it was actually above the normal to abnormal range at 2.74. And so that's another factor in how they come up with the follow-up recommendations for this patient. It was come back in 6 months and compare thermographically and also compare to ultrasound imaging. So here is a slide that shows you about tight bra marks. You can see underneath this woman's breast heading towards her back that she's wearing, it's my guess that she's wearing a tight bra. I normally only see these when patients confirm that. And I can see that she has 2 straps on her bra that are kind of digging into her, who knows how many hours a day. So you could see a line right here going towards her back as well down here on both sides there. And let's see, go back to those questions that I asked, how many hours a day do you wear your bra? And so we've got 12, some said 8. So yeah, some women can wear their bra for even 15 hours or more every single day. And think about that, what that is doing to your body if it's too tight. You're congesting your lymphatic system and literally trapping toxins right in the breast tissue. So we don't want that. That can lead to future issues that you don't want to have to deal with, like lymphatic congestion, breast cancer, mastitis. So definitely, ladies, if you're wearing an uncomfortable bra, loosen them up. And I first learned about that when several years ago, I read a book called Dress to Kill. And it talks about in societies where women wear bras, breast cancer is very prevalent. And in societies where they don't wear bras, there's like 0 breast cancer. And of course, seeing these images all day long, every day, that really hit home for me. So I made a switch right away. I dug out my underwire, made little slits in my bras and pulled out the underwire. Sometimes some of these heat signatures on the side can be from chronic underwire, poking a woman in the side there. And I also bought little bra extenders online. My bras are all pretty expensive. I wasn't willing to just toss them at the time. So, I just loosened them up. Instead of being super tight, now they're all comfortable and loose fitting on me. I even recently became a stylist for a company called Ruby Ribbon. You can go onto my website, flowwell.org. I'll type that in the chat box. And click on patient health tips, and then read number 3. It gives you the link to that book, Dress to Kill. It gives you several other links for Ruby Ribbon or other bra companies that I've found or patients of mine have found comfortable fitting bras for. You want to make sure they're their proper fit. Here's my warning slide. So some of the following cases are extreme cancer cases. There are actual photos to show you what you see in person as well versus on thermal imaging. So this one is a case of inflammatory breast cancer, and that may not be detected on mammography. It also can be a very quick progression if surgery and treatments are not done fast. So I believe this woman came in to see us in February, and then she was recommended for a 3-month follow-up because of that heat signature in the right breast here, this yellow. And then in just 3 months that got red, and then in 3 months later, full inflammatory breast cancer going on there. And unfortunately, this woman, this was September, this last picture, she passed away the following January. But in some cases, had she been coming for years prior, had she been screening things, had she been detoxing, who knows, it may have saved her life. This patient knew she had cancer at her first visit with me in July of 2012. And this is a very unusual case where the tumor has grown significantly. Her natural treatment wasn't working, and but it was killing the tumor, it just wasn't fast enough. So that's why you can see this large tumor on the side there. She eventually did end up getting a mastectomy, and some cancers are so tiny that they would never hurt someone, and some are really aggressive, and a tumor like this could be the results very quickly. Excuse me. Here's a before and after scan that was improved. This is what I live for as a thermographer. I love seeing when patients come back and heat signatures have improved. So because of vascularity on the right breast there, the delta T average temperatures are out of the normal to abnormal range. This patient's follow-up was 6 months, and not only did her heat signatures go down, the vascularity throughout both breasts decreased as well. And again, this is just what we love to see. So another before and after scan, this woman I would say did not improve. You can see the armpits got hotter, the breasts have less circulation in them right now, they're colder. Go ahead and notice the increase in heat in that armpit area. So underneath the breasts, there's lack of circulation in the nipple and the breast tissue. And with lifestyle changes, we're confident that this patient could show improvements at her next screening. Without them, toxins could linger for years, and then a problem could develop. So thermography is not just for the breast. This is some images of a woman's face where I would say she has normal oral inflammation. So that's lucky. A lot of people have yellow and red in the mouth area. And then these are some images of the legs and the feet. We always look at the bottom of the feet to see if there's any heat imbalance there. You can see the bottom of this right foot. is a lot hotter than the left. So for that, I would encourage her to go and do body work. And we want to make sure whatever that imbalance is, that she works it out, because we don't want her one day to sprain that ankle. Thermography can also be used for thyroid screening or checking on lymphatic congestion. This is one of our patients who did improve. And for another breast health tip, we can relate this to the breast, and that if there is inflammation in the mouth, you can quite often see a direct path that's heading down. And where do you think it goes next? The breast tissue. So for anyone who has dental infections, amalgam fillings, root canals, you want to talk to your dentist about your options so you don't have bacteria or inflammation persisting for years or longer, and eventually it pools down in the breast and can develop a problem down there. But this is, again, what we live for, what we love to see. Whatever this patient did, she's heading in the right direction. At her follow-up scan, we see less red and less yellow, and that is excellent. An inverse grayscale image where you can see oral inflammation heading all the way down into the breast. Another one where the oral inflammation improved. And even in the neck, even in the back, you can see when oral inflammation improves, it can also help with the neck, or this could have been, an imbalance in her spine that got adjusted and back into alignment, or certain body work techniques. She can head in the right direction, which less inflammation is the right direction there. This is the shot of the front of the face. This is the most extreme case I've ever seen of the cerebrovascular screening. You have your carotid arteries here on the side of the neck. They feed the blood supply into your brain through veins that rest right here and here on your forehead. That's why we take the temperature measurements on the forehead. And this is the only patient I've ever seen who's had a black forehead. So his right carotid artery was so darn clogged, he wasn't getting any blood supply to the right, and he did eventually have a stroke. Here's the spine improved. You can see in this child here, less red. That is what we like to see. Looks like his right hip was out of alignment in this first scan, and now he looks much more balanced. Abdominal inflammation, our interpreting doctors correlate what different organs are underneath any heat signatures for you to then investigate them further, and hopefully for preventing future issues. Case of melanoma we saw. Without having this woman do a health scan, we would have never known that melanoma was on her back. Most people think it looks like a mole, but this was just a strange vascular pattern. These are actually some arms and hands here that are normal. Quite often I see abnormal findings of the arms and hands, but these are the colors we want to see, just a little bit of dark green, yellow, and staying away from extreme colors like red, white are really hot, or magenta and black are really cold. The hair, it doesn't have a blood supply, so that's going to be black. That makes sense. The bottom of the feet, if this was actually a chiropractor, if he knew how to really utilize thermography, he may have avoided a sprain. He ended up a few weeks later spraining this right ankle. So here is our thermography process. We go through intake forms, acclimation, image interpretation, schedule a consult with a doctor. It can be your own doctor or one that we send to you. And then we offer a second report review in this format, in webinar format now. And we can also do one-on-one calls with you if you have more questions. So here are our thermography types and fees. For every full body scan we do, we give back a portion to United Breast Cancer Foundation. So they actually help people to get money for their thermography. So that's a great company to check out, ubcf.org, and all the different screening types that we offer. So here are ways to save on thermography. If you go ahead and sign up today, you can save. There's the United Breast Cancer Foundation. Some people use their HSA or their FSA account. We have the patient referral program that I mentioned earlier, and prepayment plan options. So if you want more details on all of this, go ahead and email Isabel at info@flowwell.org. And let's see, what else here? So there is a code that if you sign up today, I'm going to type it in the chat box here to everyone. I had one person selected. Let me fix that. Let's see. Event $50 off. And then you can schedule right on the homepage of my website. It's flowwell.org. If you're interested in checking out what's happening with you thermographically. And it's not to be combined with any other discounts except our referral credits. Those you can get as many as you refer. So that's been a very successful program for us, and people love getting those credits. And so all we require for you to book is a $50 deposit. It's fully refundable if you do need to cancel or reschedule, as long as you give 3 business days notice. So this October, please move towards optimal health and away from disease with Thermography. Go ahead and put your name in the chat box with a private message to me with your phone number, or I can call you so that way I could call you and schedule if you want assistance, or you could do it on your own and use the code in the chat box. And I want to thank you all so much. Look at me, I ended right at 5:30, so Gail can start. Thank you so much for listening to me today. And here we have Gail. And then you can move this video if you need to. Just kind of grab it and move it around, okay?
Okay.
All right.
Up there. Maybe I should put it.
I don't know.
Leave it up there.
Okay.
All right.
And then just hit that one to advance.
All right. Good evening, everybody. Thank you for joining us tonight. I'm very excited that Marlene has allowed this platform for us. It is Breast Cancer Month, and so I just wanted to, can everybody hear me? Okay, Mark, thanks. Okay, so a little bit about myself. I'm a colon hydrotherapist, but I'm also an instructor of colon hydrotherapy, and I've been doing this for over 20 years. Before that, I was an herbalist. And so when you get into this profession, you just do not stop going to school. You continue to go to school and to add more things to your toolbox. So I also do biofeedback and proton genie and a few other things. My specialty, though, what I love the most is helping people to detox their bodies. And that goes along with colon hydrotherapy, but most people don't understand that you really should detox all of your organs. And so I'm going to talk a little bit about breast detox, because most people talk about breast illness. And it's really hard to talk about breast wellness without putting a little bit of the good, the bad, and the ugly in there. So we live in a culture of mixed messages about the female breasts. I mean, a lot of times women's breasts are feared. It's a symbol of their sexuality. It's also a site of pain and life-threatening diseases. And so there's a lot of fear around the female breasts. Mainstream medicine teaches us the importance of early detection and for breast illness, but we're not really taught about breast wellness. We're told to do a monthly exam, but most of us, and I've talked to many, many women, they're just not shown how to do a breast exam. Some people are lucky, their gynecologist will give them a demonstration and show them how to do it. But many of us, and especially if we're a little bit older, over 40, we weren't taught what to do. A lot of us are afraid of our breasts. A lot of us don't really know the anatomy and physiology of our breasts. This speech was really good because it gave me a chance to kind of look at things. In fact, it also made me, some of the things I found when I was researching this, it made me call a researcher, and he's on the line with us. And so I'm going to have him talk a little bit about biofilm, because I wasn't aware of that in the breast. I was aware of it in the colon, being a colon therapist. But in the breast, we've got blood vessels, we've got fatty tissue, we've got a lot of lymph nodes. And I think that a lot of us, that's how our cancer starts, is through the lymph nodes. Shanna touched on this quite a bit. She talked about that most breast cancer is found in women, but a lot of men get it too. We don't talk about men. And what I found was that 1 in every 100 breast cancers that are diagnosed in the United States is found in a man. So this is not a very good screen, but I wanted to show you a little bit because men have muscle, they've got fatty tissue, they've got nipples, but they're not looking for, they're just not looking for lumps or anything else. Some of the warning signs is that they do get a lump. They might have a discharge. It's the same as with women. Sometimes it's red. Men just sometimes are not in touch with their bodies, and sometimes the skin dimpling. So I want to go more into the breast wellness because I think that that was really exciting for me. I want to talk about how to detox the armpits. As a colon therapist, we talk about detoxing your kidneys. We talk about doing a lymphatic drainage massage. We talk about lymph drainage. We talk a lot about colon therapy, but we never talk about detoxing our underarms and our armpits. A lot of us don't even look at our deodorant. When you turn the back of a deodorant bottle over, there's just a lot of things that you can't pronounce that are there. And so I think it's really important. I mean, I grew up in an era where we had antiperspirants, where we sprayed our deodorant on, not knowing that there was a lot of chemicals in there. I probably did that the first 20 years of my life. So I want to read this to you because it's really important. The armpits are the body's entry and exit points. I think that's really important for people to realize. Deodorants are designed to mask the smell of bacteria from sweating. And a lot of people, I mean, I think almost everybody that I know, I'm not going to say everybody that I know, but a lot of people, as part of their daily regimen, is put deodorant on. And as a colon therapist, I always say that if your colon is clean, that your armpits will not smell. And that's the truth. Anyway, I'm going to go to the next screen because I want to kind of get through. There's a lot of slides here. I'm going to encourage everybody to do like an armpit detoxification. And a lot of people don't know how to do that. What I'm going to say to you is that it takes probably 2 to 6 weeks to fully detox your armpit. There's many ways to do it. Most of us don't think about doing it. Sometimes people will put baking soda under their arms and then it burns. And when it burns, that means that you're really toxic. If your arms are detoxed, you won't feel that burn from the baking soda. This is a really simple recipe that you can make. And the recipe is just putting some bentonite clay, making some bentonite clay and mixing just a couple tablespoons of apple cider vinegar. Some people can put some aloe because it makes it softer, but just putting that under your arm is a great way to start detoxing your armpits. I want to go a little bit into some of the vitamins for the breast. And of course, vitamin D is a big one. It's big for more than just breast health. It's big for osteoporosis, hypertension, diabetes, and just all kinds of things. It's very important for the breast. Years ago, as my body was changing seasons, I was experiencing a lot of breast pain myself. And surprisingly, a nurse said to me, she said, "Why don't you start taking vitamin E?" Well, I fluctuate with vitamins. Sometimes I take them, sometimes I don't. But I'm going to tell you, the vitamin E really helps when you're going through any sort of breast pain. I think it stopped the pain immediately. It's kind of a balance of fatty acids in your cells. This is really important to me, and this is kind of where I wanted to bring Mark in, because Mark is, he's in Texas, by the way, but he's written many, many books on biofilm, and he's written books on probiotics. Now, as a colon therapist, I tell all of my clients to please, take a probiotic. I always tell them that they need at least 35 grams of fiber. Now, Mark was going to probably say that they need 50 grams of fiber. So I always tell them, the word HOPE, 35 grams of fiber, omega-3 oils, which really does help with breast. It helps with colon, but surprisingly, it helps with the breast too. Probiotics is right there. And probiotics is probiotics is what we need to balance the good bacteria from the bad. But we also need a prebiotic. And I'm going to let Mark talk about that in a minute. Probiotics is the actual bug in your body, and it pushes all the bad stuff out. But the prebiotic is the food for the bug. And so you need a combination of both. Mark, can I bring you on? It's how do I?
He can unmute himself.
So I'm going to let you unmute yourself. If you can talk a little bit about probiotics, and I'm going to change the screen so that we can go into the biofilm, because I was really surprised to learn that before I go there, I'm going to go ahead and talk about some of the prebiotic foods, which are things such as dandelion greens, garlic, leeks, onions, asparagus, bananas. It all nourishes the probiotics. And I'm going to let him add to that. But I do want him to talk about the microbiofilm in there. So Mark, I'm going to let you unmute yourself because you've got really excellent information. When I was studying this and I came up against the biofilm, I was surprised. And I mean, I knew it was in the small intestine. I've worked, as much as I know about colon hydrotherapy, I did not realize the biofilm that's in the breast. And I think this is important for women to know. So Mark, do you want to go ahead and talk about that a little bit?
Yeah. Thank you, Gail. Can everybody hear me? Are we on?
Yep, I can hear you.
Okay, great, fantastic. Well, I want to thank you for having me on and being able to talk about the bacteria. My main interest in bacteria or the was gut bacteria, which is kind of the mainstay of staying healthy, so to speak. And so that's what I study. That's what I work with. But lately, as you mentioned, you have bacteria in your breast as well, and that's very important. Very important.
Can everybody hear Mark? Great, great.
Can everybody? Okay, we're good. But we're finding that there's bacteria in our breast, and there's a variety of bacteria. And what's important about it is detection. We're now getting into a field where we can detect breast cancer via bacteria. And what we noticed is that there's a certain group of bacteria that surrounds breast cancer. What we're not sure of is, does the bacteria group form before the breast cancer, or because of the breast cancer, we do have this particular form of bacteria. So we're kind of toying back and forth, but it's a group of bacteria that only exists around breast cancer. So we're kind of excited about that. So we're trying to connect the bacteria to the breast cancer. And we're real happy because we're doing that in the colon in a lot of different ways as well. 80% of our immune system is bacteria in our colon. So we want to take care of it. A little bit about the microbiome, the prebiotics, and the other is that the prebiotics are the food, as you mentioned, food for the bacteria, and that's real important. You may ask, okay, what can I do about this? How can I stay healthy or do better? It's all about, or mostly about, the fiber. We do recommend taking at least 30 grams of fiber, usually in the form of natural foods. And lately we've found that you can increase this up to 50 and get even more benefit out of it. So the fruits and vegetables are the prebiotics in a lot of respects. They're the ones that feed the bacteria, particularly the good bacteria, the balance in it. So we're kind of excited about our field and we're moving forward. And now we're finding that it has to do with the breast as well, and breast cancer. So if anybody has any questions, I'll be happy to answer, but that's kind of a brief example of what we're dealing with in microbiota.
Thank you, Mark. So don't go away because I want you to maybe talk about this next slide that I found. And what you saw in the first slide was there's a cancer there. And then around there is kind of like a bacteria or microbiofilm. Mark, is that correct?
That's correct. The microfilm,
Okay.
what a microfilm is actually a film around the bacteria. It's usually generated by the bacteria itself, and it's made for a protective mechanism. So our immune system can't fight it. And that's why we get into problems. If our immune system could fight this bad bacteria, we probably wouldn't have any. So the bacteria to survive sets up a film, a protective film around it, and it's called a biofilm. But
So basically all those words right there, it's a bacteria that's there. And then if you look at the next one, go ahead.
So again, the biofilm protects the bacteria. The problem, and that's great if it's good bacteria, but if it's bad bacteria, then the antibiotics and your immune system and everything can't get to it. And this is particularly important where we're getting a lot of these infections that are hard to cure with the antibiotics and stuff like that. It's the biofilm that's keeping the antibiotic from approaching the bacteria itself. So it's a huge field, coming to be a huge field, the biofilm. But it's just a protective mechanism for the bacteria.
So when you look at the slide next to it where it says Western diet, and you see all of those words there, which is bacteria from the Western diet. And then if you look below that where it says Mediterranean diet, and then there's good bacteria that's there. And so basically what the slide is saying to me is that, when you go to other countries like in Japan and places like that, they don't have the rate of breast cancer that we have here in the United States, but a lot of their food that they have is, it's fermented food. It's the kimchi. There's a lot of fermented foods. There's a lot of yogurt. There's a lot of, things with probiotics in it. And so it creates a healthier breast for people. So here are some tips for keeping the good bugs in your breast happy and thriving. We always recommend that you take a gut probiotic. And sometimes I have a hard time with that one. And the reason I do is that I know that the stomach is full of acid. It's, the acid in the stomach is 1.5 to 3. So a lot of times, depending on what bacteria or what probiotic you're taking, it doesn't usually make it past the stomach acid. But I know that if you're taking fermented foods, if you're eating that, it does make it past the stomach acid into the small intestine where it populates where it needs to be. Unfortunately, that with our lifestyle, a lot of the good bugs in our body, like, they're depleted with our diet, with stress, with medications. And a lot of us, are taking antibiotics. And so I just think it's really, really important to get good bacteria or fermented foods in your body. Marlene's Market and Deli's got a great selection of fermented foods. This is just a picture I put up there. Sometimes I like to make my own fermented foods. It only takes about 30 minutes to make, and it lasts for a while. But more than likely, I'm going to stop by Marlene's. I'm going to pick up my jar, and I'm going to take a tablespoon with each of my meals. I have my family on it. A lot of times when they see me coming with the jar, they give me that look, but they don't argue with me. They take it. So this is one of the reasons. This is even more reason to start doing fermented foods or taking a gut probiotic. I just wanted to put the slide up there. It's foods that may lower breast cancer. And of course, it's all of your citrus fruits. It's your fatty fish. It's your berries. It's your fermented foods. Again, it's common sense. It's just, it's eating healthy and taking most of the carbs out. Kale, spinach, mustard greens, those are all great foods to help prevent breast cancer. Shanna touched on breast massage, and I think that this is really important for a lot of women. As I talk to women, it's really funny that a lot of women are not in touch with their bodies. They're not in touch with their breasts. Even as a colon therapist, most of the time I try to massage their stomachs, and it's just, women are very protective of that. But breast is, a breast massage is not the same as a breast exam. It's really crucial to be in touch with your breasts and to know what's going on. A lot of women experience pain. And so I know that massaging your breasts is really good. Shanna put in the chat room a place where you can, some information on a video where you can watch breast massage. It's very interesting. But here's some information, and we'll be able to share these slides with everybody in case you want to read about it. Most massage prevents your breasts. It reshapes your breasts and it prevents it from sagging. It stimulates circulation. I'm just going to read this, and keeps your breast tissue healthy. It breaks up cysts in your breast. So massaging your breast is really crucial, but also what you're massaging your breast with is crucial as well. Some of the tips for massaging your breast is that you want to warm your hands up, or you want to warm up the oil. And you don't want to be harsh on your breasts because they're delicate. You want to do it in a circular motion, but I'm going to let you go to the video that she recommended because I think it's really good and it will give you some tips. You want to massage your breast for about 15 minutes. Consistency is key. You want to do it quite often. Some of the oils that I recommend or that I found that are great is primrose oil. I tell a lot of people when they're experiencing monthly, PMS, primrose oil is good to take, but it's also really good to massage your breasts in because it's rich in fatty acids. It also eases skin inflammation and rejuvenates the skin. Primrose oil to me is just one of my favorites. I really love it. Emu oil is good, not for people like me that are vegetarians because it is extracted from a bird. And I'm just kind of funny about, what I put on, but I had to talk about this because emu oil penetrates about 7 layers in the skin and it nourishes the skin and it's great. It does wonders in reducing stretch marks. There's just layers of cells. And so it enhances it enhances the size of your breast, but there's a lot of good nutrients in the emu oil. So I just wanted to put that slide up there too. When you ask a lot of naturopathic doctors or doctors about what to do for breast cancer, breast cysts, breast soreness, a lot of them, what they say is pokrit. Pokrit it's great. A lot of people are afraid of it, but I think it's really good if you do it right. It's one of the best things for breast health. It helps to dissolve cysts, and it also gets rid of the inflammation. It also helps with congestion, swelling, and it's great for lymphatic. We've got over 700 lymph nodes, and we've got between 500 and 700 lymph nodes in our body. A lot of them are in the neck area. A lot of them are around the breast. And surprisingly, there's 150 lymph nodes in the colon. So pokrit is really good for moving the lymphatic system. Of course, you want to mix it with some other oils. Some people are afraid of pokrit, but I would rather use it than not use it. It's great for breast massage. It's great for fibroids over the uterus. It's great for lymphatic cleansing, urinary tract cleansing, colon cleansing, and it's just great with breaking up cysts and fibroids. So I asked a lot of doctors as well, what else would they use? And they said iodine. You have to remember, I'm not a doctor. I'm a great colon therapist. I'm a student, a full-time student. I'm always studying what can I help my clients with? What can we, because clients come in. I've worked with a lot of breast cancer clients because I worked in a breast cancer clinic doing colonics every day. And the fear and the pain that they have when they come in, it's heart-wrenching. And you hold their hand and you look in their eyes, and a lot of this information was never presented to them. So this presentation to me is really important to be able to get this information out. So I worked with a doctor over in Gig Harbor. His name is Dr. Russell Coble. And one of the things he said to talk about was iodine. And iodine is really good for breast health and is really good for hormonal balance. I'm going to read this because there was a lot of information. It's an essential trace element. It aids in hormone production. It's particularly in the thyroid. It's promoting and regulating physical and mental growth. It promotes healthy hair, nails, skin, and teeth. It's really good for the nervous and muscular system. It's regulating circulation, which, with breast, you want to make sure that everything is circulating. And that's why we're recommending the massage. It's really good for removing abnormal cells, and it's great for killing viruses. So after the thyroid, this was surprising. Breast tissue is another major storage site for iodine. Mark, do you want to add something about that? Because I know that you've studied that as well.
Well, I know iodine is good for many, many uses, and when we're low on iodine, we have a multiplex of problems in itself. So I haven't had any experience with the breast itself in relation to iodine, but I know it's essential, especially if you have a lack of it. It's hard to tell till you really get deficient in it.
So thank you. But it also says that it's good for a variety of different illnesses, not just the thyroid. But I think the biggest piece for me taken away is the amount of thyroid iodine that's in the breast tissue. There's a lot of different iodine that you can buy. This is probably one of the most popular that's out there. I know that you can get a lot of it in your food, but I don't know if we're getting enough of it in our food. You know, it's foods such as shrimp, yogurt, navy beans, strawberries, potatoes, and cheese. You just want to make sure that you're getting a medical grade iodine supplement. I know that I've seen iodine at Marlene's Market in Delhi. I don't remember the names exactly, but I know that they do have iodine there. One of the ways to apply this is that you want to add 1 drop or 3 milligrams of iodine and 1/4 of a tablespoon of water. And then you want to just kind of paint the breast, put it directly on the breast. Sometimes it discolors your skin, but it will absorb and it disappears very quickly. You can paint a 1/4 size dot right over the pain if you're having pain in your breast, or you can just paint the whole entire breast. I think it takes about 2 weeks and you start feeling a difference in the breast is what I've heard. This next piece is just common knowledge. And it is, you know, if you want to help your breast wellness is, you know, a lot of people have quit smoking. I know that there is this craze to quit smoking. So you want to limit alcohol and caffeine, and then you want to keep it at a healthy weight. We always encourage that you eat at least 5 servings of fruits and vegetables every day. And there's so many ways to get that in. I know that in the last year or so, I've been adding a lot of fruits and vegetables. My breakfast sometimes looks like my dinner. You also want to make sure that you're exercising. And I know that with the weather changing here in Washington, I just moved here from Phoenix, where you can go out and take a walk almost every morning. It's 80 degrees there. But here it's a little bit colder, so it's a challenge to get out there and exercise, but it's so important. And I know with breast cancer and with the lymphatic system, exercising doesn't have to be just really exercising. It's just movement. It's maybe doing a slow walk and it's moving your arms. That moves your lymphatic fluid. You want to avoid heavily processed foods, and you also want to make sure that you're getting enough sleep. A lot of women, when they start having breast problems, their sleep is broken and they wake up in the middle of the night. So if you're waking up, you want to find a healthcare professional. Maybe they can help you to get back on track. You also want to make sure that you're aware of your breast appearance, because a lot of us, sometimes we're so busy that we just don't pay attention, and that's really important. Self-awareness is important. I just want to put in the piece about colon therapy, because remember, I've done colon therapy for 20 years. And colon therapy is just a great way to remove lymphatic fluid. A lot of people think that colon therapy is just getting, you know, the excess poop out, but it's not. When you're doing a colonic, you'd be surprised at how much lymphatic fluid comes out, especially if you're drinking enough water. I know that this went pretty fast, and I know that some of you probably have questions. If you have questions, please put it in the chat box, or if somebody has some questions now, I'd love to address it. Just raise your hand and maybe, or type it there, maybe I can answer that. I saw a hand. All right. So I'm going to say one thing is that I'm very, very grateful for the platform tonight. I'm grateful that you joined us. And I just want to say thank you. And I'm also grateful for Marlene's Market in Delhi for giving us this platform to meet and to share educational information. I've enjoyed spending this time with you. Shanna, do you want to add anything to this?
Do you want to
Thank you, Gail.
Your contact. Yeah.
Okay, so I just wanted to leave my contact information with you. I work in 2 different clinics. I'm over in Gig Harbor 3 days a week, and I'm in Spanaway 3 days a week. So I'm going to let Shannon finish the conversation, and I look forward to hearing from you. Thank you.
Thank you, Gail.
Thank you, Mark. It was great to
My
learn
pleasure.
from both of you over there. Let's see. So, okay. So someone said they didn't get my links. I maybe accidentally was sending them to someone privately. Perhaps. Yep, that's what I did. Sorry. Let me send those to everyone real quick. Thank you for letting me know. Okay, there's the YouTube link. There's my website. I'm going to get Gail's website in here as well. So that everyone will have that to contact Gail. Let's see, I also put that coupon code in here, didn't I? And I see there are a few questions, but since we're out of time, I'm just going to go ahead and email those questions, and Gail, I'll let you know about the questions as well, and we can contact each person individually. But please let me know if there's any links that are missing besides those ones. Thank you for your email address. Awesome. We've got a lot of contact information here, a lot of questions, and we will be sure to get to those. So thank you so much for attending our presentation tonight, everybody, and I hope you have a wonderful evening. Thanks again. Thank you, Marlene. Thank you, Gail.
Thank you.
Hello, everybody. Thanks, Mark.
Thank
Bye-bye.
you.